So, Aciclovir with regards to breastfeeding. So the drug goes into the breast milk at concentrations ranging from 0.6 to 4.2 times the corresponding plasma concentration, and a very small amount of the drug has been measured in one nursing infant's urine. However, no toxicity was observed. So generally caution should be exercised when administering the drug to a nursing mother. With regards to the usage of the drug in pediatric patients, there is limited data available for the use of the drug in children younger than 2 years of age. But however, there has been no unusual toxicity of pediatric specific problems have been observed in studies done in children using doses of up to 3,000 milligrams per square meter of body surface area per day, and also 80 milligrams per kg per day. So that's what we know so far about pediatric patients and the usage of Aciclovir. In geriatric patients, studies have not demonstrated any problem that is specific to the geriatric population that would limit the usefulness of the drug in the elderly. However, the elderly patients are more likely to have an age-related decrease in renal function, which may require an adjustment of the dose or the dosing interval. You might expect also, with regards to the blood urea nitrogen and the serum creatinine concentrations, to be increased in patients taking Aciclovir. Drug interactions. So when we use nephrotoxic medications, concurrent use of these kind of drugs may increase the potential for nephrotoxicity, especially if there is presence of impairment of the renal function. And when you use probenecid, using usage of probenecid together with this drug may decrease the renal tubular secretion of the drug, causing increased in the serum and CSF concentrations, and also prolonged elimination half-life, and potentially you might increase the toxicity of seen in the patients taking Aciclovir. So dosage and administration for adults with genital herpes infections. Initially, we start with oral tablet of 200 milligrams every 4 hours and 5 times a day for 10 days. So you give it 4 hours every 4 hours while awake. Okay, so you can omit the time so you only take it 5 times a day, but during the time that you're awake. Okay. So for example, if you take it 8 o'clock in the morning, and then 12 o'clock, and then 4 o'clock, and then 8 o'clock, and then another one at 12, for example. Okay, so that's 5 times a day. Okay, then the next dose is at 8 o'clock in the morning. So you do this for 10 days. For recurring infections and intermittent therapy, Again, it's oral 200 milligrams every 4 hours while awake, 5 times a day. The only difference is that this is given for 5 days instead of giving it for 10 days. And for recurring infections, for chronic suppressive therapy, it's oral 400 milligrams twice a day, or 200 milligrams 3 to 5 times a day. So that's about for patients with genital herpes infections. For zoster, herpes zoster, you take oral 800 milligrams 5 times a day for 7 days. Okay, that's for zoster. For varicella, that is chickenpox, you take oral 20 milligrams per kg of body weight. So for example, if you're 60 kg, so 60 times 20 is 1200. Okay, so it's orally 20 milligrams per kg of body weight up to 800 milligrams per dose. So that's the maximum. So 800 milligrams per dose, 5 times a day for 7 days. Okay, that's for all. Yeah, if you're so 800 is the most. A lot of people will be taking 800 if they are adults. And treatment should be initiated at the earliest sign or symptom of chickenpox. Okay. So what is the recommended dose for initial therapy and intermittent therapy of herpes infections with renal impairment, patients with renal impairment? So if your creatinine clearance is about for genital herpes, okay, for initial or intermittent therapy, if the creatinine clearance is more than 10 mL per minute and the dose is 200 milligrams 5 times a day, and if the creatinine clearance is 0 to 10, the dose is 200 milligrams every 12 hours. For chronic suppressive dose therapy, if the creatinine clearance is more than 10 mL per minute, the dose is 400 milligrams twice a day. If it's 0 to 10 mL per minute, then the dose is 200 milligrams twice a day. For herpes zoster shingles, if the creatinine clearance is more than 25 mL per minute, the dose is 800 milligrams 5 times a day. Okay, if it's 10 to 25 mL per minute, 10 to 25 mL per minute, then the dose is 800 milligrams 3 times a day. And if the creatinine clearance is 0 to 10, so this is the renal function is not good, and the dose is 800 milligrams twice a day. So for children, for varicella, chickenpox, the dose is 20 milligrams per kg, 20 milligrams per kg, just like the adult dose actually. So maximum of 800 milligrams 4 times a day. Okay, or if the patients are under 2 years old, for example, you can take 200 milligrams 4 times a day. Or if 2 to 5 years old, 400 milligrams 4 times a day. And for patients over 6 years old, you can the recommended dose can be 800 milligrams 4 times a day. So with for overdosage symptoms, it's mentioned that patients who have ingested up to 20 grams, okay, so that's quite a huge amount, about 10 tablets. Okay, 20 grams. Yeah, it's more than that. Okay, 20 grams of Aciclovir. They didn't show any unexpected adverse effects, and anuria and acute renal failure may occur. For recommended treatment for overdose, there is no specific antidote, so it's symptomatic and supportive. Adequate hydration may be needed to prevent the precipitation of aciclovir in the renal tubules, and hemodialysis may help in the removal of aciclovir from the blood, especially in patients with acute renal failure and anuria. So storage conditions is store below 25 degrees and protect from light. So presentation, some companies will it will come in blisters of 25 and 50 tablets for the 200 milligram tablet of aciclovir, and it can come in blisters of 50 tablets for the tablet of 400 milligram aciclovir. Okay, that's all for now. See you in the next video. Thank you.